Thank you. Good afternoon. I'm wondering, as we move into this new phase, what type of surveillance systems will you put in place to, accurately monitor any transmission in the community or to be able to identify variants in the future?
Thank you for that. That's a really great question. I didn't talk about surveillance. We did talk about it a couple of weeks ago, but this is what we're working on with our team, particularly at the BC CDC, but we have a number of different things. We are going to be moving to a weekly report rather than the daily numbers, and hopefully that'll be very soon as well. And what we will be looking at is integrating the surveillance that we're doing for COVID into our serious respiratory illness surveillance that we have all along. So there'll be ongoing testing from sentinel physicians. We've got a way of doing that we do for influenza that will be including COVID. We're looking at expanding the wastewater testing surveillance that we're doing over time and expanding it not just for SARS-CoV-2, but for other pathogens to help us understand what's circulating in communities around the province. We are looking at how do we use regularly, routinely collected blood for other reasons to help us understand if we're seeing an increase in seroprevalence of COVID. So these are all things that we're adapting and modifying what we're doing now as we're in this transition phase. So we'll have more details about that, but it will be looking at how do we make sure we have a way of seeing a snapshot on a periodic basis of what's happening. The other really, really important thing is we are continuing our whole genome sequencing, and the sampling that we're doing and how much we send for whole genome sequencing will vary as we see transmission and amount of virus circulating in the communities decreasing over the summer, hopefully, so that we're prepared for the fall. So these are all really important questions that the team is working on.